So what I know before entering the patient room is that Landon is a 22-year-old male and has had asthma for 10 years. He uses Flovent MDI daily and an albuterol MDI as needed. He has had flu-like symptoms for about 36 hours now, and his mom really wants him and his younger brother put on Tamiflu. So upon assessment, I find that Landon has developed fatigue, generalized muscle aches, some chills, kind of hot and cold, poor appetite, although he is drinking fluids, and he also has a non-productive cough that started about 36 hours ago. His lung sounds are clear. He has not checked his temperature at home, but has taken some over-the-counter cough syrup for his cough that has helped some. Landon's brother, however, has no symptoms, and no one else in this house is sick, and as you see, his vital signs are listed below. On this slide is some of the symptoms that develop with influenza, such as headache, fever, muscle tiredness, joints, aches and pains, a runny or stuffy nose, sore throat, coughing, and nausea, vomiting. Influenza may start out and seem like a cold to people, but colds usually develop slowly, whereas influenza tends to have a sudden onset. So how do we test for influenza? A rapid influenza diagnostic test can be used to detect the virus in nasal secretions, and is one of the most common methods used to diagnose this infection. It's usually done bilateral nares, and it can be done usually in the doctor's office in less than 15 minutes, or it may be sent to the laboratory with results the same day. However, the sensitivity to this test is usually only 50 to 70%, so diagnosis can also be made based on clinical symptoms. Patients who either test positive for influenza or have suspected influenza should be placed on antiviral medications. These medications work best if they are started within the 48 hours of symptom onset. Patients with any risk factors should especially be placed on these medications, and these risk factors include any kind of pulmonary disease like asthma, especially if they're on any glucocorticosteroids. Cardiovascular disease is also another risk, except for hypertension. Any kind of active malignancy, renal insufficiency, liver disease, diabetes, any immunosuppression, or any of the neurologic condition can be a risk factor for severe complications of influenza. Therefore, this medication has been shown to decrease the symptoms of influenza by a half to up to 3 days if started early. Antiviral therapy can also reduce the spread of influenza when used prophylactically if there is someone in the household that is positive for the flu. The treatment of choice for influenza is Tamiflu. The adult dosing is 75 milligrams twice a day for 5 days, and the prophylaxis is 75 milligrams once a day for 10 days. It does come in a liquid concentration of 6 milligrams per ml, and with pediatric dosing it is all weight-based dosing. For patients with any kind of renal impairment, there are dosing adjustments that need to be made. If patients are end-stage renal disease and they are not on dialysis, Tamiflu is not recommended. Patients with any kind of liver impairment, from mild to moderate, there is no dosing adjustments needed. However, there are not really any studies for any kind of severe hepatic impairment on what dose to give for Tamiflu. There is a Class C pregnancy category, and as far as breastfeeding with Tamiflu, low concentrations have been detected in breast milk. The manufacturer recommends that caution be used if administered with to a nursing woman. Levels are unlikely to lead to toxicity in breastfed infants. However, still use that caution. Some of the side effects for Tamiflu include nausea, vomiting and diarrhea, nightmares in children, problems concentrating, abdominal cramping and pain, and headaches. However, a lot of these side effects you get with influenza anyway, so it's hard to, what is the medication, what is the virus. Tamiflu is a neuraminidase inhibitor. Like I said, it does reduce the intensity and duration of symptoms. So the sooner this is started, the better it works. It is eliminated by the kidneys, and usually the prices that I found, it costs between $110 to $120 per treatment dose. Usually covered by insurances. It's a tier 2 drug, usually a moderately high copay. From what I could find, $30 to $35 for a copay if insurance is there. So as I was researching influenza, I kept finding information on the Spanish flu in 1918. It was one of the deadliest pandemics in modern history. It affected about a third of the patient's population and killed an estimated 20 to 50 million people. I think last year in 2015, I think the mortality rate for influenza was about 4,500 people. I think a lot of that is to do with the influenza vaccine. The vaccine first came out in 1933. So as I was researching influenza, I kept finding sites for the Spanish flu from 1918. This is actually a flyer from the public health back then. This pandemic was one of the deadliest in modern history and affected about a third of the patient's population and killed an estimated 20 to 50 million people. In 1933, they discovered what the flu was, and in 1938, the first influenza vaccine was developed. However, it wasn't until about 1979 that they started actually having a public vaccination program when the swine flu broke out for the first time there. But not many people used it, and it wasn't until later on that people actually started using the vaccine more and more. I think I found that last year, that 2015, about 4,500 deaths occurred from influenza. So we've really have come quite a ways. Now back to Landon. What are we going to do with Landon? Well, even though Tamiflu does work best if started within 48 hours of symptom onset, you can still get some benefits if started a little bit later, especially if the patient has any risk factors, as Landon does with his asthma. It's very important to stress the annual flu vaccine. However, you don't want to give it if he's having symptoms, but it is the first and most important step to the flu protection. Landon has to stay home for at least 24 hours after his fever is gone. He should cover his nose and mouth when he coughs or sneezes, and hand wash, often with soap and water or alcohol-based hand rub. Disinfecting surfaces can help prevent the spread. Stay hydrated, rest often. Avoid high-risk patient populations such as the very young, the very old, pregnant people, immunocompromised people, and also stress the importance of, if he's not getting better, come back and be seen again, or if he's getting worse, develops any real shortness of breath, go to the ER. Pneumonia is a complication of influenza, especially if you do have asthma, and I would just stress the side effects of the Tamiflu and what to watch out for, and also fever control is another important issue too.